Welcome to DBC Diaries, episode 55. I'm here with returning patient Robert. Welcome back, Robert.
Hi.
So you were here last year and you had some shoulder issues and we were just kind of talking and you had this pretty cool story of how you found us. So where did everything start?
Okay, so basically I was doing some shoulder exercises and I didn't realize that at the time, but basically I'm inclined to getting shoulder impingement. It has to do with the shape of my rotator cuffs. I'm just, if I do front lifts, I can do it. And basically I got into extreme pain after a while doing this exercise. And I eventually had to seek help from an orthopedic surgeon. And this is in Arizona, Scottsdale. And the surgeon had me take an MRI and confirmed that I had some serious tears over my rotator cuff. And he basically had two solutions for me. He said basically you could either do surgery, the classic fix. Unfortunately, you'd have to not use an arm for about 6 months and it had a 50% chance of failure. And it cost a lot of money. So it was just not a very appealing solution. And he gave me a second choice, which was to try PRP, which even he was just basically starting, which is, using your own blood to generate stem cells. And, I chose the second path and he basically gave me some cortisol shots and I went through the PRP and it helped a little bit, but it never got me, past, I still had, 40% pain. So it was never 100% chance. I was never quite satisfied. And this took a year to run its course. And I basically tried a different place. Dr. Neil Borden, I think, has a clinic also in Phoenix. Well, they still can't use real stem cells, but they have other
Procedures. And they can do the fat-derived or the bone marrow.
Right, they recommended the fat-derived treatment, but she tried basically injecting some kind of sugar treatment to activate stem cells. I tried both of them and it just wasn't getting me to where I wanted to be. So then I said, okay, I'm going to start looking at the stem cells. I heard that you can only get in Mexico, but still finding, where to go was a big issue because there wasn't a lot of transparency in the places I looked in, Tijuana, for example. There's many places, it's not clear where you're getting for your treatment, or, a lot of these places either they don't speak English, or if they do speak English, they have some, kind of, the prices are very high, basically.
Sketchy stuff in Tijuana?
Yeah, that's good for other things, but, stem cells, I'm not so sure about. So basically, I stumbled upon the DBC through Reddit because I was doing, more research. I just, it was just so hard to find good information. And I like the transparency on the website. So I said, you know what, I'm gonna go for this because this issue of mine has dragged over many years, and I just wanted to get fixed if it could be fixed. I wanted to try it.
And so last year we did the shoulder shot, and how are you feeling?
Yeah, so basically I was completely satisfied. Basically 100% of the pain is gone. And I think I got it done over spring break, and over 6 months it got better. And yeah, so I'm very satisfied with the result. So I'm here to try.
Yeah, you're back doing the other shoulder. So
yeah. So during that time, when I had only one shoulder working, I injured the other one. So
that's a common problem. You start favoring the other one, and then you can end up having issues there. So got it.
Right. And I guess the other thing I'm trying this time, I'm also trying the hypertension treatment, just because hypertension is another thing I've kind of battled with for a long time. I've tried everything, even the stuff that goes beyond the normal classical solutions. I have like my steam sauna in my house.
Okay.
For example, so I'm just trying to say I'm going through the extra mile. I'm like taking flaxseed every day. So I go beyond everything, but I'm hitting a floor, my blood sugar. So I'm just trying that out and seeing if that can help me.
Yeah, so we're doing the 300 million IV, and Helps a lot of people with blood pressure, and that's because a stem cell is technically a parasite, right? So they live on the outside of capillaries. So imagine my arm is this little tube capillary, live on the outside, and they squeeze and release and control the blood pressure on those smaller blood vessels. So with these going through your system, a lot of them will find capillaries to call home, squeeze and release, help with blood pressure, but immediately they all go to your heart. And obviously that's the root of all blood pressure, the heart. Doesn't mean you have any heart problems or anything, but if there is any damage, anything going on, well, that's the first place they're going to go. And that usually is what will fix people's blood pressure. Then they go to the lungs. There's a lot of damage people have there. About 70% will get stuck there for 2 to 3 hours. Then they'll go through the rest of your body. They'll target inflammation. It's another thing that can, help or contribute to high blood pressure. So you're finding inflammation, reducing it, and hopefully get your body just in a great state. One thing I think you'll notice, I noticed when I did my first 300 million IV, is that I'd go to the gym, I'd see incredible results. No, I mean, it's good to know, like if you hit the gym hard after this, like, you can't with your shoulder for 6 weeks because we want you to do a little rest and recovery, but once you're feeling it again, you could do legs in the meantime, but like you will notice you build muscle easier because it seeks out inflammation. You tear those muscles, they heal faster. So it's good.
Yeah. So look forward to any bonus benefits I can get. And it sounds like I might see something else. So
yeah, there's a lot of, it's people come, look, if you look at the website, the IV treatment, there's probably 50 treatments on the site, and it's all, it's just the IV, and there's a lot of crossover, but it can help with a lot of different things, which is really good there. And then the treatments you had been offered before, so you were saying like the sugar water, right? They call that prolotherapy.
Yeah.
And it has nothing to do with stem cells. The whole idea there is it's going to cause some inflammation, which is going to bring more growth factors to the area. And the problem there is even if you get the growth factors there, they can't get past the scar tissue. And the way the body heals, when you hurt your shoulder or your knee, white blood cells rush to the area, and then they can only heal with fibrosis, which is scar tissue. So now you got this patch-up job, and the growth factors in your own bloodstream can't get past it. Mm-hmm. So by putting the stem cells in the area, they're going to get there, they're going to clear out all that waste, all that scar tissue, then they can get to the underlying tissue. Now they can start healing. So that's the big difference. The other option you talked about was like the fat-derived stem cells, which, hey, it's better than nothing. But what they don't tell you is they take that fat, they centrifuge it up to separate the cells from the tissue, and less than 1% of that liquid is mesenchymal stem cells. Yeah. So you might get a few 100,000 cells that way, where we just put 50 million in your shoulder. It's like just from a numbers game. It's
exactly.
Yeah. So it's a big difference. We worked with Dr. Arnold Kaplan. He's actually the one that Dr. Riordan did his PhD under, and
oh wow,
he advised us and explained a lot of that. And you used to see him at conferences. He'd get mad at the clinics doing it because he'd go, "That's not a stem cell therapy." He'd go, "That's a cell therapy." Because 99% of what they're giving you is different types of cells, 1% mesenchymal stem cells. But, it's the United States, it's marketing. It's
exactly.
If it's even got a few, they'll call it that. So it's unfortunate. I wish they would open it up to be able to do this. But the problem is the way the system's built. Mm-hmm. To get this approved, you would have to go, first, it's $2.5 million to apply for a new medicine application. Uh-huh. And all that does is give you access to do all 4-phase trials of the FDA. And now, when you do all 4-phase trials, you've seen my website. There's like 100 treatments listed, right?
Yeah.
We only get to pick one for the FDA trial.
Oh man.
So let's say cartilage for knees, because that's the most common thing we treat.
Right.
Well, now it's going to take you close to 10 years, and it can take anywhere from $100 million to $1 billion to get through this process. And at the end of that, you can't patent a mesenchymal stem cell. So you'd just be opening the market for all your competition. So what are they going to do? They're going to undercut your prices.
Yeah.
And you just spent all this money for something like no one's going to come to you for because you're going to be too expensive. It's a really backwards system, unfortunately, but I think it's there to protect the big pharmaceutical companies that can afford to patent things and do this. So it's tricky.
Right. And I guess the other part of it is the existing doctors in the U.S., they're charging an arm and a leg for these treatments that don't quite fix anything. And like, for PRP or the adipose, I mean, you can get a full-blown course of a lot of real stem cells here. And it just, if people actually knew the difference, it's like, there's no way they would to choose the US path, except basically because of the information and basically they're not allowed to know the truth, basically. I guess if you search on the internet, you're going to say, okay, stem cells, the evidence has not been proven. But the reality is, if you really look at the people who take the real stem cells, they're getting the actual results, right? That's being, the waters are being muddled completely.
Yeah, and you'll call that anecdotal because it's like you right now. You're giving your testimony, and you can say this worked for you. And, you can see before and after MRIs, but because we didn't do it in a study, for some reason that doesn't count, right? And then the crazier part is if you go to Google Scholar and look it up, there's over 100,000 studies on mesenchymal stem cells. But even with all that, like, Dr. Kaplan told me he would talk to the head of the FDA every year. And whenever he'd ask if they're going to allow mesenchymal stem cells, every time they'd say, oh, we need more studies. Like, how many do you need? Like,
right. And obviously, I do feel they're trying to protect these ineffective, drugs and treatments.
Yeah.
I'm not saying it's just a scam, but it's obviously not.
It's just a bad system, I think. Yeah, the problem. And once you're in that system, you're stuck. In fact, they were doing what we do in Canada years ago.
Oh.
And in Canada, there was a big clinic in Ontario outside of Toronto doing like what we do. And they started like 9 years ago. And then 7 years ago, they had to shut down, not because they did anything wrong, but because the orthopedic surgeons in the area started complaining so much to the government that they eventually like banned it. Like, it's tough. I don't even think they do the fat-derived in Canada to this day because when they shut it all down. Yeah. And it wasn't because it didn't work. It worked too well. The orthopedic surgeons didn't like that and petitioned so hard they got it shut down. I mean,
makes sense.
It makes sense, but it's like, it's sad, You're like, those are the people that are supposed to be helping you,
Right, exactly.
So
I guess crazy. Yeah, at least my orthopedic surgeon tried to use PRP, but still,
Yeah, and there's great orthopedics out there, and a lot of them will play with, like we work with a guy, I've got videos with Dr. Jacoby. He's one of the top guys in your area for like diabetic foot issues. And he was using stem cells for a long time. Like even, you can get umbilical cord, but like they have to, the rule there's two rules: minimal manipulation, so they can do like what they do with their PRP. They can spin it up, separate the cells, and inject it. But again, it's not pure mesenchymal stem cells.
Right.
And they actually have to freeze these cells, which kills a lot of them. So you can get like a few million, best case. But even then, they can be dead. And he was doing feed because the second rule was that it's called homologous use, like for like, which is a really vague way of saying it has to treat the same thing as where it came from. Well, if it comes from the umbilical cord, unless you're injecting into the belly button, how do you justify that? So his justification was he treats nerves, and there is a big nerve that runs through the umbilical cord that connects mom to baby. In fact, women, one reason they think women that have had kids tend to live longer is because they get a free mesenchymal stem cell transfusion from the baby when it's in the womb. It transfers over mesenchymal stem cells to help the mom heal from any injuries during that time. And they've proven this because they found like MSCs in the bone marrow of these women that had, XY chromosomes instead of XX. And they're like, well, why do you have male? Like, why are these in there? So they do know they transfer over. And so that was his thing. There's this, because he's treating nerves, it was like, but then they started getting even harder with enforcing it. So like he finally stopped doing it, which is why he came to us, and he's got a few other clinics he kind of like talks with, but it's just, it sucks because, you think they'd be moving towards helping more people, but they actually keep cracking down harder and harder. So that's just kind of where it's at right now. But luckily you can come down here, hang out in paradise and get some stem cells. Well, cool. Thanks, Robert. Thanks for sharing all that. If you at home would like to learn more about stem cell therapies, check out our website. It's www.dreambody.clinic. Scroll down on the homepage. You'll see all the treatments listed. Click. There's info. There's prices. Everything's there. Or you can call us toll free at 888-704-3977. I'm Josh. Happy to help.